I'm Andrea Flores. Even though more businesses are starting to reopen, COVID-19 is still top of mind for many of us. That's why every week we get your coronavirus questions answered during a special segment called Q&A with Dr. Dave. Joining me now is CBS 4 medical editor Dr. Dave Hnida. And Dr. Dave, researchers in the UK say they've come up with a possible breakthrough treatment for those seriously ill with coronavirus. Tell us a little bit more about dexamethasone and how it works.
Dexamethasone is a medication that's been around since the 1950s. It's in a group of medications that are called steroids, things like cortisone or prednisone, things that we use for a variety of conditions. Now, these medications work by decreasing inflammation in the body. And when you think about COVID-19, COVID-19 causes just a bunch of inflammation in the body, especially in the lungs, causing them to clog up. So using this medication seems to make sense in terms of decreasing the severity of how COVID affects the body, particularly the lungs. Here's the thing, though. This study that is out of the UK does show some very promising results. But the thing to think about is the fact that here in Colorado, we have been using dexamethasone as well as similar medications for COVID-19 for the past couple of months. So this is nothing new to us here in Colorado, and it has been shown to be modestly successful. The big thing, though, is that it really is found to be most useful in people who are hospitalized, who require oxygen, or people who are hospitalized on ventilators. It's not a miracle medication. It's not anything that we would use on an outpatient basis. So let's say you're at home recovering from a case of COVID-19 that is not severe enough for you to be in the hospital. It's not a medication that we would typically prescribe, but it is a good thing to have in our regimen of treatments.
And turning back to Colorado, last week, Governor Jared Polis announced a new phase called Protect Our Neighbor, and that could allow large events like county fairs as soon as July. Dr. Dave, what is your reaction to this new phase?
Well, this certainly isn't a small step going into this next phase. It's a giant leap, and it's a good one. I mean, it's very encouraging to see that we're going to be able to have larger events and larger venues with more people involved. The big thing, though, is really going to be a matter of making sure that we are able to maintain this, because right now we've seen some very good numbers in Colorado. They have been decreasing on a regular basis. However, over the last 3 days with the rolling averages, there's been a little bit of an uptick. And so what's happening is officials are keeping a really close eye on this. And really, what's going to wind up happening here is we're going to need to continue to work very hard on the basics. Once again, that takes us to things like wearing masks and physical distancing, as well as good hygiene, if we want to continue to advance, because the last thing we want to do is let our guard down and we wind up going backwards. And so all of these forward steps that we are taking right now are all of a sudden steps that we need to retreat from.
And a number of states are reporting a large jump in COVID-19 cases, but officials in those states say the increase in cases is simply due to an increase in testing. But is that truly the case, and what does it mean for Colorado?
Well, it's interesting because about 23 states have seen a rise in cases of COVID-19. And particularly when you go from Florida across the south to Texas to Arizona, the numbers, the jump has really been pretty alarming. And sure, there is more testing going on, but two things you got to take note of. And the first is the percentage of those tests that are being done that are coming back positive is a lot higher than it used to be. So positive tests, and not simply due to the testing itself, it's due to behavior. The other thing that you need to take a look at is the number of hospitalizations. Hospitalizations is probably your best indicator in terms of what's going on. And all across the southern United States in the Sun Belt, we are seeing an uptick in the number of hospitalizations. So once again, it's not really the tests that you're blaming in this situation. It really is behavior. People really need to recognize that, we're not out of the woods yet. People are thinking, well, we got to worry about the second wave. We're still in the first wave. So please keep in mind that you need to follow guidelines here in Colorado as well as elsewhere throughout the country. We need to be protecting ourselves, but we also need to be protecting our families and our loved ones, as well as those in our community.
Dr. Dave, thank you so much, as always, for joining us, and we'll see you back here next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just visit cbsdenver.com.